Hello everyone. Today's class is going to be about circle system. This class is mainly to make you understand what is circle system because I haven't seen many questions in the circle system, but I have seen every year repeatedly questions have been asked in Mapleson system. So Mapleson system is a semi-open system. Circle system is a closed system. So you have to differentiate, you have to know the difference between Mapleson system and circle system. To know that, you need to understand some basic points about circle system. So that is why we are going to see in this class today. So definition and components. So a breathing system. First we will understand what is a breathing system. So breathing system is something which is used by the anesthesiologist to give oxygen and reuptake and retake the carbon dioxide from the patient. Basically, it's like it is acting as a respiratory conduit to the patient. So a breathing system is an assembly of components. It is not one thing, it is an assembly of components which delivers gases from the anesthesia machine to the patient's airway. To the patient's airway in the sense either endotracheal tube or supraglottic tube or a face mask. So this is the definition of breathing system. It is an assembly of components which delivers gases to and fro from the anesthesia machine to the patient's airway. Now, if the gases flow in a circular pathway through a separate inspiratory and expiratory channel, that is called circle system. So the inspiratory gas goes through an inspiratory limb to the patient, and from the patient the expiratory gas comes through the expiratory limb to the reservoir, and then this air is again purified by the reservoir, then sent again into the inlet, inspiratory limb. So it acts as a circle. So that is why it is called as a circle system. So the components are a fresh gas inlet. So for any breathing system, there has to be a fresh gas inlet. So the oxygen, nitrous oxide, and the volatile anesthetic needs to get into the system through a fresh gas inlet. And the inspiratory and expiratory unidirectional valve. We will see what is unidirectional valve in the later slides. And inspiratory limb and expiratory limb, which are corrugated tubes. And Ypiece. Ypiece is nothing but the tube, the Y-shaped connector which connects the inspiratory limb and expiratory limb. And APL valve, adjustable pressure leak valve. I think there has been a questions regarding components of a circle system, and APL valve was the answer given. Adjustable pressure leak valve. So this valve is used to adjust the pressure inside the system. So circle system is a closed system. So inspiration, patient, expiratory limb. So it goes like a circle. So the gas goes inside. The gas is taken, a little amount of gas is taken by the patient. The remaining gas is given out of the patient, and it circles. So constantly gas is coming inside. Some gas is getting absorbed. To maintain the pressure inside the system, we need a adjustable pressure leak valve. So this valve can be set into various pressure from 0 to 70 millimeters of mercury. So normally we set it around 20 to 40 millimeters of mercury. That is the pressure inside our lungs. So that is the so to adjust the pressure only, we have this adjustable pressure leak valve. And there is a reservoir bag. So the reservoir bag, the function of the reservoir bag is to give positive pressure ventilation to get the excess gas that is present in the system. And finally, a canister contains CO2 absorbent. CO2 absorbent soda lime canister we will see in a separate slide, separate class. Now these are all the components. You just remember the component. So I will show you a small simple GIF to understand the circle system. So this is the fresh gas inlet. So the fresh gas inlet goes through it enters into the inspiratory limb. So it goes through the one-way valve. So this is the inspiratory unidirectional valve. Unidirectional in the sense that valve will allow only gas to pass during the inspiration, and during the expiration that valve won't function. So that is unidirectional valve. Now this is a volatile anesthetic. You don't see this part. You just remember this is the corrugated tubing, inspiratory corrugated tubing, and here we have a Y-piece connector that is connected to the endotracheal tube or trachea. So gas goes into the lungs through this inspiratory limb, and the gas After the respiratory gas exchange has happened, the gas comes out of the lung into the expiratory limb. So this gas which is coming out of the lungs and entering into the expiratory system, how it will enter? Because of this unidirectional valve only, because this valve will allow only gas passing through the inspiratory inspiration. During expiration, this valve will close. So the gas automatically has no other way has to enter into the expiratory limb, because the expiratory limb also has a unidirectional valve. So the gas will pass through the corrugated tubing into the expiratory limb and enter the unidirectional valve, and it will go to the soda lime canister. So the canister, after entering the canister, the soda lime, that is the CO2 absorbent, will absorb the excess carbon dioxide, excess unnecessary other volatile anesthetic, and it will give the gas back into the inspiratory system. So it acts as a circle. I think you would have gotten the point now. So it acts as a circle. That is why it is called as a circle system. And we have one inlet, that is fresh gas inlet, and one outlet. So this is the adjustable pressure leak valve. So the function of this adjustable pressure leak valve is, whenever there is increase in pressure inside the system, the excess gas is vented out through this system. So this valve will open like this, and the excess gas will vent out of the closed system. So this is how it maintains the pressure, and this is the reservoir bag. So this reservoir bag has two functions. One is it can give positive pressure ventilation, that is when you squeeze the bag, the air will enter into the inspiratory limb and goes to the patient. And again, during the expiration, the bag will slowly expand. Then again you can squeeze it, inspiration will happen, then you have to wait for the expiration to occur, then slowly the bag will expand. So this is how you can give positive pressure mechanical ventilation. That is one function. The another function is the excess gas. So whenever there is a more amount of fresh gas, the fresh gas flow is more than that of the needed for the lungs per gas exchange, that excess gas will get collected inside the reservoir, and once the pressure becomes more than that of the system, what is set, so you can set the pressure like 20 millimeters of mercury or 30 millimeters of mercury. So after more than, if the pressure goes more than that, this APL valve will automatically open and vent out the gas. I think now you would have able to understand what is per closed system. We'll go further. So fresh gas inlet, it is connected to the common gas outlet on the anesthesia machine by a flexible tubing. So see, anesthesia machine has three components. One is high pressure system, intermediate pressure system, and low pressure system. After passing all these three systems, the gas will enter the fresh gas flow. The fresh gas flow will go to the circle system. So circle system is different, anesthesia machine is different. So we will see about the three systems and cylinders, vaporizer in separate class. For your level, for MBBS level, we will discuss only salient points. Now unidirectional valve. We already saw about unidirectional valve. One function you already know, used to ensure that gases flow towards the patient in one tube and away from the patient in other tube. So this is the function of unidirectional. So here is one unidirectional valve, here is one unidirectional valve. It is covered by a transparent glass-like material. So we can see whether the unidirectional valve is functioning. It will go up and down like this. I will show you another picture. So like in the previous picture, we got one-way valve in the inspiratory circuit and one-way valve in the expiratory circuit. Now, so this is the picture of unidirectional valve. See, the gas comes through this tubing. So this is here one tubing is there, and here one tubing is there. So gas will come to this tubing, and what will happen, the pressure exerted by the gas on this disc, so this is the diaphragmatic disc, it will push the diaphragmatic disc above, and the gas will escape like this. So the escaped gas will go into the inspiratory limb or expiratory limb, whatever it is. So imagine if the gas comes backwards like this. In this first picture, if the gas comes backwards, the disc won't open. The disc is flat, it is closed. So the diaphragm won't open. So this is how the unidirectional valve functions. Okay, you can read the theory for yourself. I have given you the explanation. Now, breathing tubes. So we know there is an inspiratory tube, we know there is an expiratory tube. So the both tubes are connected by a Eyepiece connector. So the dead space extends from the the inspiratory and expiratory tubing is corrugated, it is reusable, it is made up of plastic. Okay. So the dead space extends from the eyepiece to the patient. So until the inspiratory tube, whatever length it is, there is no dead space. What is dead space? The air there which does not take part in the respiratory gas exchange. So the dead space is only up to, from the eyepiece to the patient. Okay. Now eyepiece. So this is the eyepiece. I think you can see in the slides I have shown you a picture. So eyepiece is also called as Y connector, Y yoke, Y adapter, and it is a 22 millimeter male port for connection to the connecting to the patient's breathing tube. Basically, it connects two breathing tubes to the patient. That is it. Now APL valve, whatever I told you in the previous slide only. So in APL valve, it is called as adjustable pressure leak valve. The function of the APL valve is to maintain the pressure inside the circle system and to vent out the excess gases and to maintain and to prevent barotrauma to the patient. So you can read the theory here. Spontaneously breathing patient, the APL is kept fully open. In a manually assisted patient or controlled ventilation, the APL is set according to a pressure. In closed system, in a complete closed system, APL is fully closed, and we have to set in a way that the fresh gas flow is exactly that of the patient's need. Otherwise, there will be increase in pressure. Now the reservoir bag. So reservoir bag is attached to the canister on the expiratory limb, and it is useful for positive pressure ventilation. Now absorber in canister. So CO2 absorber in canister, it is also called as containers, chambers, units, cartridge, whatever it is. The absorber is held in canister. The side walls are transparent so that we could see inside whether the canister is exhausted or not. CO2 canister and CO2 absorbent I have discussed in separate class. Now this is the component arrangement. Basically whatever we saw in the first slide, fresh gas flow, inspiratory valve. We have a humidifier because we are bypassing the upper airway. Our humidifier is our nasal paranasal sinuses. So while intubating the patient, we are putting the tube into the trachea. So we are bypassing. So we need to have a humidifier. Then we have an oxygen sensor here because we need to know whether we are giving oxygen. Because sometimes we may there could be an interchange between the pipes. Nitrous oxide can be given in the place of oxygen, so we need to have an oxygen sensor. Patient cannot tell us because he is paralyzed, he is anesthetized, so we have to keep an oxygen sensor. This is inspiratory limb. This is the eyepiece. So the dead space extends from the eyepiece to the patient, and there is a gas sampling line. This is for gas monitoring, for end tidal carbon dioxide monitoring and volatile anesthetics gas monitoring. Then from the patient, expiratory limb comes and we have a airway pressure sensors. We need to know what pressure is inside the airway now, because we don't want the patient to experience barotrauma. So we need to ventilate in a normal pressure, that is less than 30 millimeters of mercury. Then we have the APL valve, expiratory valve. This goes to the absorber, and we also have a reservoir bag here. Okay, now test for the circle system. So flow test, there is nothing but you just take the two tubes, inspiratory and expiratory tubing. You have to blow into the inspiratory tubing, and you won't be able to blow. You won't be able to blow into the inspiratory tubing. In the expiratory tubing, you will be able to blow. This is how you test the flow inspiratory and expiratory unidirectional valve functions. Now, so leak test, nothing. You just close the eyepiece. So APL valve is fully closed. Eyepiece is occluded. Then you set the you open the flow gases, or you give a oxygen flush, so that the pressure inside is 30 millimeter, and you leave it like that for some time. The pressure should not change. If the pressure changes, then that means there is some leak inside the system. If the pressure is same, there is no leak. This is very important. Normally accepted leak is up to 50 ml for 1 minute. Not more than that. You should not have a leak more than that. So this is about circle system. So this is just to make you understand what a circle system. There are few points which are important in the circle in this thing. Components is important. Adjustable pressure leak valve is important. Unidirectional flow, valve is important. Then your test for a circle system, that is flow test and leak test. That's it.